Hi, I'm Dr. DrMiracle from the Cuyahoga County Board of Health, and I'm going to speak with you about some ways to help stop the spread of COVID-19 in your facility. One of the ways to stop the spread is to first identify those folks that are coming in from hospitals that have COVID-19 infection. We recommend you do this by having them in quarantine for 14 days once they come to your facility, whether that be a resident that's returning from a trip to the hospital or a new admission. Those folks should be in a separate part of your building, being cared for by particular staff that are dedicated to those folks and monitored for signs and symptoms of COVID-19 infection. If they become symptomatic, it's important that they are tested for COVID-19 and proper precautions are taken once that is determined. In terms of organizing your building so that you can contain the spread of COVID-19, it's important that you have a means to cohort those persons that you are evaluating for COVID-19 infection, those residents, to have them in a particular part of your building separate from those residents that you do not believe to have COVID-19. It is also important to cohort your staff so that there are particular dedicated staff for those folks that you are either concerned that they have COVID-19 or they do have a confirmed COVID-19 infection. It is especially important to limit the amount of staff working in your facility that round or go to other facilities. We have found in our experience of helping various different nursing homes, SNFs, long-term care facilities in helping with their COVID-19 outbreaks, we have found that this can be a big source of COVID-19 infection. There are often folks that work part-time at several different places, and they may be working at a place that has COVID-19 infection, and then they're coming to your facility and bringing it in with them. So it's very important to screen your staff for any type of other job that they have, that they're working at other facilities. And it's especially important to ask them if they have any exposure to COVID at those facilities. It is also important to screen your employees for signs and symptoms of COVID-19 infection. We recommend that every employee is screened with both a temperature check as well as a symptom checklist before entry into the building for each shift. Additionally, we recommend that as many folks as possible utilize telehealth to minimize the amount of providers that are, say, rounding at hospitals, rounding at other nursing homes, coming in to your facility if they potentially are infected with COVID. It is best to have them utilize telehealth as much as possible to minimize the risk of infection. We hope that these tips help you to stop the spread of infection in your facility, and these recommendations are constantly changing. In order to stay up to date, please check the CDC website as well as the ODH website to make sure that you are following best practice.